Today, we're going over physical therapy treatment for lower back pain during squats and deadlifts. Welcome to the Fitness Pain-Free Show, where I help physical therapists learn how to get their clients out of pain and back to training in the gym. My name is Dan Pope, and I'll be your instructor. I'm a physical therapist, coach, and fellow meathead. I love training just as much as you do and want to help you get all of your patients out of pain and back to the gym where they belong. First and foremost, thank you so much for your support. You truly allow me to do what I love for a living. My name is Dan Pope. I'm a physical therapist, coach, personal trainer, and meathead. Yes, I love lifting weights. I love everything fitness. This is a Fitness Pain-Free Show where we help coaches and physical therapists like you get your patients out of pain and back to training. If you're watching this on YouTube, please hit that like button, comment, and subscribe to the channel. If you are watching this via podcast, please consider giving me a positive rating and review. It helps me a ton. If you want to go that extra step and support me further, consider subscribing to Fitness Pain-Free Insiders. It's a comprehensive educational resource and toolkit for the fitness and rehab professional. Think Netflix, but for trainers and physical therapists. All the content is premium, and it's uploaded by me, yours truly. I've been updating this once a month for the past 5 or so years. You've got over 100 webinars, ebooks, and complete guides. You have access to a private Facebook group to have all of your questions answered by me. You can also decide topics for upcoming podcasts, Fitness Pain-Free shows. You can get started for just $1, right? So if you want a week-long trial, it's just $1. After that, it's a subscription membership of $9.99 per month, so not very expensive. You can cancel anytime. So if you want to get started, head to fitnesspainfree.com, click on the programs link, and then click on Fitness Pain-Free Insiders online library. So first and foremost, why are we talking about squats and deadlifts as it is going to relate to lower back pain? So I have a ton of references in this presentation today, and they're all going to be in the show notes. So if you want to check it out at any point, feel free to do that. If you want to read any of the studies, if you disagree with anything I'm saying, I'd love to hear about that. So check it out and let me know your thoughts. So if you look at some of the survey data, and this is for weight training and also weightlifting sports, so strongman, CrossFit, Olympic weightlifting, the low back is commonly injured, right? It's the number one injury for strongman athletes. And the lower back is among the 3 most injured areas in powerlifting, Olympic weightlifting, and CrossFit, right? The other thing that's interesting in squats and deadlifts are most commonly reported exercises to create low back pain. And it's most common to exacerbate low back pain after you have an injury. So let's say I have lower back pain and I'm trying to go in the gym. Generally speaking, squats and deadlifts are going to be the worst exercises in terms of pain. All right. And this is really true with what I see. I'm a physical therapist, right? I've been in the gym for about 20 years, working with athletes in the gym for about as long. And I got to tell you, squats and deadlifts are generally the most common offenders. So the most likely to create lower back issues. And they're also going to be the most painful after you have lower back problems. One caveat is maybe extension-based low back pain, and sometimes that's a bit different, but that's really a specific example, right? Is weightlifting or weight training dangerous? So if you start looking at some of the medical data and survey data that we have on this topic, you'll find, not especially, all right? A lot of folks think that if they're going to train in the gym, especially if they train heavy in the gym, it's going to create a whole bunch of injuries, but that's not really true, right? The injury rates are relatively low, and they're also very comparable to other forms of fitness. So talking about, let's say, running, I've read a few studies where recreational, let's say handball, right, squash, tennis actually create more injuries than just working out in the gym, all right? There's definitely fewer injuries in strength training compared to contact sports and other field sports, right? And this is with high levels of participation and high levels of competition. So elite level bodybuilding, Olympic weightlifting, powerlifting, and strongman are going to be lower than contact sports, right? And field sports. So really, the benefits of strength training far outweigh the negatives, right? And if you want to have an in-depth breakdown of some of these injuries and injury rates, I did an entire show about this, right? I'll allow you to click this. There'll be a link right above. And if you're listening to this via podcast, I'm going to leave the link in the show notes. Okay. So definitely check that out if you'd like me to go a little bit more in depth about injury rates and CrossFit specifically. So let's go over some low back pain basics to kick this off, right? So generally, the majority of the low back pain episodes will improve over the course of time. That's great, right? It's very important to remain active and get back to your activities, including work, quickly, right? And it's not dangerous to do that. So if you're getting a back injury, it feels like the end of the world. It feels like you have to lay in bed all day long, all right? And as physical therapists, it's just really important to understand this and have some empathy for the people that you're working with, but also just telling these guys, hey, it's good to get back to your activities. I'm actually dealing with a pretty bad bout of low back pain myself currently. And it's mostly hilarious when I go to work and I'm trying to do everything in my regular routine, right? I'm doing the whole try to pick things off the floor by going down with a super upright spine in this lunge position and bending slightly to the side, trying not to tweak my back, yeah, and it's funny. Actually, I mean, it stinks, right? I shouldn't say it's funny, but it's kind of funny to watch me move around. But I'm getting to work, I'm getting on with life, and things get better over the course of time. So it's important that we just let our patients know that, right? The other thing that's really cool about low back pain is that it's improved by strengthening, right? And commonly, there's a lot of things that get low back pain better. Active approaches seem to work the best, and there's a variety of ways to get people out of pain, but strengthening is one of the ways to do that. And you know what? Most of the patients I work with, they want to do strength training, all right? So I want to give it to them, and I know it's going to help them get out of pain, right? And the last piece is that regular strengthening is helpful for preventing low back pain in the future. So if we can get our patients onto some sort of exercise program, it's going to reduce the likelihood that low back pain will recur, which we know it does over the course of time, right? So I thought this was a really cool stat I got from Chun Che et al. 2014 in clinical rehab. Sorry, I probably butchered that name. But this was about spontaneous recovery of lumbar disc herniations. Basically, if you herniate a disc, will they heal over the course of time? And the short answer is yes. So the rate of herniated discs becoming smaller over time was 96% for sequestrated discs, 70% for extruded discs, 41% for protruded discs, and 13% for bulging discs. And we're not going to go into a big anatomy lesson here, but suffice to say, the more severe disc injuries, so sequestrated discs, have a very high rate of getting better over the course of time. And the smaller disc injuries, so let's say just a bulging disc, the majority of those actually feel better over the course of time, but they don't have to resorb to have complete elimination of symptoms. Okay, so it's a very positive outlook when you have pain, despite it feeling terrible. Okay, so just understand your patients probably feel like garbage, but they're probably going to get better over the course of time. All right. So here's the thing. I just talked about how most low back issues are not a big deal and that they're going to get better over the course of time. However, we always have to be on the lookout for red flags. If you have a patient presenting with a medical red flag, they need emergent attention, right? And some of these issues, people need to have surgery within 24 hours of symptom onset. Okay. So it's important that you are really on the lookout for these. If you don't have any red flags, great, go ahead and treat. But if you do, that could be a very emergent situation. Okay. So the big ones that we're looking out for are going to be some sort of cancer or infection. So the red flags would be a history of cancer, unexplained weight loss, immunosuppression, urinary infection, IV drug use, prolonged steroid use, back pain that is not improved with conservative management. You're also going to be on the lookout for a spinal fracture. So this could be some sort of history of significant trauma, right? Did someone just get in a car accident, a minor fall or heavy lift in a potentially osteoporotic or elderly individual? So you have someone that has poor bone density and they fall. There's a chance that they break their spine, right? You could have prolonged use of steroids, which also is going to predispose you to a fracture. And lastly, called equina syndrome or severe neurologic compromise. So these folks usually have an acute onset of urinary retention or overflow incontinence. Okay. They have a loss of anal sphincter tone or fecal incontinence. They could have saddle anesthesia. So basically having some sort of numbness or tingling anywhere that a bike seat would touch you if you're sitting on a bike. And lastly, global or progressive motor weakness or lower limb weakness. Okay. So if you're having these things, got to go to the doctor right away. All right. You definitely don't want to treat this with strengthening and physical therapy. You need to see the doctor. All right. What are the causes of lower back pain in the gym? I want to kick this off with a story, and I hear this from so many patients. So, a patient that comes in, the lower back hurts, right? And you're like, you know what, Dan? I'm squatting. I keep on getting this low back pain. I think there's got to be something wrong with my technique. I've watched a few exercise videos. I try to keep my spine in neutral position. I don't know what the deal is. I think there's something still wrong with my technique because my back continues to hurt, right? And we just have to educate these patients because they somewhere along the line, they've got the idea that technique is the only reason why their back can be painful in the gym. We know that's not the case. All right. So I want to go over some specific causes of lower back pain in the gym. And here's the thing: injury onset is complex and multifactorial, right? There's a lot of reasons why your back can get hurt in the gym. And I'm extrapolating some of these reasons why people get hurt in the gym from other sports injury research. Unfortunately, we don't have a ton of great research just in a weightlifting population. So a lot of this is coming from the sports world. And of course, you can go check out all of these references. They're in the show notes, right? But take this with a grain of salt because it's not coming from just the weightlifting population. All right. So the big one that potentially can cause a lower back injury in the gym is looking at total volume of training and also spikes in volume, right? So a spike in training volume is essentially having too much training volume in a program. This could be over the course of a week, over the course of a day, over the course of a month. Basically, more work for your back than what the back is currently used to. All right. That's referred to as a spike in training volume. Okay. Now, here's a couple places where the medical literature has shown this to be true. So, if you introduce a squatting, a deadlifting, or Olympic weightlifting program too quickly, so basically you're not prepared for a given program and you jump straight into it, that can cause an injury. Okay. So, I see a lot of folks that are doing a traditional strength training program and all of a sudden they incorporate, let's say, a hatch squat program, right? Or some sort of Smolov training program. So, you go from squatting once a week heavy to squatting 4 to 5 times per week. Okay. So, you just quadrupled your training volume. And over the course of time, that can lead to an injury, right? The other thing you'll see in the medical literature is being a novice trainee. So less than 6 months to a year worth of training experience. And this is coming from the CrossFit, some of the CrossFit medical literature. So if you haven't been training for very long, it's just a good chance that you're going to get hurt because you're probably not used to or prepared for the training volumes that someone who's been training for 4, 5, 6 years would be, right? So it comes down to your training history or sports background. The other piece that can cause problems is a lack of consistency with training. And this is especially true with CrossFitters. So let's say that you come in 3 to 4 days per week, usually, right? And usually on those days, you're training snatching, deadlifting, and let's say squatting. All right. But you miss a few days or your schedule changes, and now you're coming in during a different day of the week. And now you're not deadlifting, but you're practicing clean and jerk, right? But you're not used to practicing clean and jerk because your schedule just shifted, right? And you're not being consistent with your training. So now you're being exposed to a different lift that you haven't prepared for, and you just have an increased likelihood of getting hurt. So it's important you're very consistent with your training to avoid low back issues. And the last piece is excessive training volume. Okay. So too much training via sets, reps, and frequency. There's a finite amount of work that the low back can tolerate. And that's going to be based on the individual as well. So some folks can tolerate a lot of stress, some folks just can't. All right. And here's the thing: the more exposure you have towards stressful exercises towards your back, the more likely you are to get hurt. So if I squat 17 times a week, I have 17 opportunities to get hurt. Whereas if I just squat 1 time per week, I have less opportunities to get hurt. Okay. And this can mess with people's heads because we know fitness is protective. So basically, if I do a lot of squatting, my body adapts to squatting and I'm a little less likely to get hurt. Okay. So per hour of time I spend, if I'm used to squatting, I'm a little less likely to get hurt. Right. But if I'm squatting 17 times a week, that's a lot of opportunities to get hurt compared to that person that maybe only squats for 1 hour per week. All right. Hopefully that makes sense. What other potential causes do we have? So excessive training loads, which is basically using more weight than your spine can handle. All right. And this theory is all over our medical literature. Although I would really like to see some specific studies that are comparing folks that are doing, let's say, over 90% of their 1 rep max frequently in training versus under 90% of their 1 rep max over the course of time and see what happens to the lower back. It makes total sense that using too much weight can cause an injury, but I'd really like to see if there's a difference between doing 5 rep max plus training or doing, let's say, 10 rep max or less than 10 reps over the course of time, if that has any difference in terms of injuries. The other piece is lack of coaching and or poor technique, right? And this makes total sense. So if you don't have someone guiding you through a training program, talking to you about sets, reps, frequency, when to push, when to back off, you're a little more likely to get hurt, okay? And technique will certainly play a role, although that is a very nuanced discussion for another day. The other piece is having poor recovery. So if you don't have good nutrition, good sleep, good stress management, or lack of recovery days between intense sessions, you're a little more likely to get hurt. And the other piece is having mobility issues, creating more stress on the spine. And we'll talk about this a little bit later. And I think it's important to understand that globally, in terms of our medical research, flexibility is not one of those things that helps to decrease your risk of getting injury. Although I certainly see cases where mobility is very important and could be a potential reason why I get hurt. And we'll talk about this later. And the last piece is not taking prior low back injuries into account. So if I hurt my low back, let's say 6 months ago, I'm a little bit more likely to have low back pain in the future, right? And this is unfortunately just something that, is inherent with low back pain. If we have had a prior injury, we're more likely to have a future injury, all right? Some other potential causes are psychological profiles or characteristics. And this is actually super interesting. This research is mostly coming from athletes, university athletes. Again, check the show notes if you want to see the references. So having a high athletic identity can increase your risk of injury. So if your whole sense of self-worth is wrapped around being a high level athlete, then if you end up getting injured, this is a major threat to your sense of self. Okay. The thought here is that you're more likely to deny pain, right? So your coping response is just to ignore that you have pain, because if you end up having pain or an injury, that's a major threat to your sense of self. Okay, so your sense of self-worth completely wrapped up in being an athlete. If you get an injury, that's a major knock on that. So more likely to just ignore the pain and work through it, which can lead to more problems over the course of time. The other psychological characteristic that can increase your risk of injury is perfectionist, right? So if you're a perfectionist, you're a little more likely to push through pain to have more sets, more reps, that perfect workout, whatever it is. And I think this is a double-edged sword, because if you're a perfectionist, that's going to help you to succeed over the course of time, but it's also going to potentially push you towards getting getting injured by doing too much, right? And again, you might be a little more likely to use denial as a coping strategy, just because it's so important that you get things right from a training perspective, that you're more likely to push through that pain, push through that injury, right? And the last piece that is related to injury is working through a less severe injury. And this research is coming from the soccer world, right? So essentially what they're looking at is folks that had a non-time loss injury, which means that, let's say I'm playing soccer and I hurt my hamstring, but it's not that bad and I can work through that. That would be a non-time loss injury. It doesn't keep me out from playing or training, right? But what happened with these folks is that if they pushed through some pain, it was more likely to cause a time loss injury, which essentially means that the pain wins. So you push through pain to the point where the pain gets worse, and now you can't play anymore. All right. And this makes total sense to me. So if you're in the gym and you're working through pain, oftentimes it does get better, and sometimes it gets worse. And sometimes it gets so bad that you have to stop, even more so. And we just don't want that. Okay. So here's the thing. I have an entire mini course. It's called the Fitness Pain Free Mini Course. And we go A to Z about these specific causes of pain in the gym. I have one lecture. It's called 7 Reasons Why People Get Hurt in the Gym and What to Do About It. I also have a really nice infographic that goes along with it. So if you want to go deep on this topic to see why people are getting hurt in the gym, and also some ways where you can prevent injury in the future, definitely click on the link in the show notes. All righty. What are the most common lower back injuries in weight training? So if you start looking through our medical literature about lower back injuries in strength training, you'll see that muscle strains and disc pathology pop up as the 2 most common injuries. Okay. I'm taking a lot of this from a study by Fairs et al. In 2020, and they were looking at adolescent/young adults in weight training. And these were people that just do recreational weight training and fitness. It wasn't strongman. It wasn't Olympic weightlifting. It wasn't CrossFit. It was just basically folks that like to go to the gym and work out, right? And they were looking at 93 patients that had lower back pain. And the results are pretty interesting. They were saying that strains, as well as disc bulge and herniations, were the most common injuries. And the way they were trying to differentiate between a strain and a disc bulge was whether or not someone had radiating pain. Now, if someone has radiating pain, it doesn't mean for sure that you have a disc bulge or herniation, right? And you can also have disc pain without radiating issues as well. So this isn't necessarily 100% true, but I was surprised by the results. they were saying that about 54% of folks that got hurt in the gym had radiating pain. All right. So they classify these folks as disc pain, disc bulge, disc herniation patients, right? And 44% of folks had strain injuries. So it'd be more non-specific pain, more localized pain in the low back, right? So they said this is maybe a muscular strain issue, which it could potentially be, right? Now, the other thing that I wanted to mention are some of the anecdotes and theories that are in the medical literature, as well as things that I tend to see, right? So you can have spondy-based injuries, right? So this could be a spondylolysis, spondylolisthesis. So having some sort of fracture or some sort of slippage of one vertebrae on another, right? And I have certainly seen some of my friends who have gone down into a squat, tried to come out of the hole, and they couldn't, felt a shift or a pop. Afterwards, they had to lay on the lifting platform for an hour because things were so painful. They go get some imaging, and yes, they have a fresh spondylolisthesis with a fracture. Okay. So it does happen. If you look at Stu McGill's original research on pig spine, they took a pig spine and they compressed it. They took another pig spine and they compressed it and flexed it. So they rounded the spine with compression. And what they found is that when they did both of those situations, they created spondy injuries, they created disc injuries, and they also created vertebral end plate fractures. Okay. The group that did flexion with compression had more vertebral end plate fractures as well as disc injuries. So that's one of the major reasons why this idea of squatting with a neutral spine, deadlift with a neutral spine is very important, just because we believe if we combine flexion with compression, it can lead to more vertebral end plate fractures and more disc pathology. I am opening up a can of worms by saying this, but I just want to let you guys know that's probably the major reason, or one of the major reasons why we believe squatting with a flexed spine can lead to more problems over the course of time. All right. Should I continue to squat and deadlift with lower back pain? So here's the short answer. Yes, you should continue to squat and deadlift with low back pain. We want to continue working towards your goals as much as possible, but we want to try to respect that injured area. Okay. The long answer is that it depends. So as a physical therapist, I have few priorities when working with my clients or patients. Basically, folks that want to come to see me, they want to get out of pain, but really their long-term goal is to continue working towards their fitness goals and continue working towards weightlifting, right? So priority number one is to keep people working in the gym, keep people trained in the gym. There are an absolute myriad of health benefits that come with weight training, that come with fitness in general. And I want to keep working towards my clients' fitness goals as much as humanly possible. All right. Low back pain is a major reason why people stop exercising. Exercising is so important for so many reasons, right? Especially from a healthcare perspective about saving healthcare dollars. It's very, very expensive when people have low back pain. They stop working, they stop exercising. It's a mess, right? So priority number two, we need to respect the injury site, right? If I throw too much stress on someone's spine, if I tell someone, hey, keep on deadlifting, keep up the same loads, don't change anything, I may worsen that person's pain, or I might perpetuate the injury, right? It might just stick around for a long period of time. And if I throw too little stress on the area, I may perpetuate the injury as well. There's a chance that that injury doesn't go away because we need the stress to drive adaptations, right? In order to get that person back to training. Right. And that comes back to priority number three. We need to stress that injury site. Okay. Like I mentioned before, strengthening actually heals lower back pain. All right. If I strengthen the lower back, it's going to help me to get out of pain. This ends up being a bit of a win-win situation. I get to have my cake and eat it too. Right. So I can continue exercising because I want to do that. It's going to keep me working towards my fitness goals. And that exercise will actually help me to get out of pain too. So awesome. How do we do this? How do I fix lower back pain during squats and deadlifts? Here are the 4 steps to success. Number 1, you need to modify and or temporarily limit aggravating training and lifestyle activities to allow the irritated low back to calm down. Number 2, identify and correct mobility limitations in the ankle, hip, shoulders, and thoracic spine to reduce stress on the spine. Number 3, correct technique issues in the squat, deadlift, and Olympic lifts. Number 4, start gradually loading the spine through a progressive strengthening program. This is going to be progressive overload for the spine, and it's also going to incorporate a slow transition back to your prior training program over the course of time. So number one, how do we modify and or temporarily limit aggravating lifestyle activities? Well, first and foremost, you have to talk to your patient and figure out what hurts, right? I always tell folks there's a lot of different flavors of low back pain. Everyone has their own little flavor, maybe a little vanilla, maybe a little pistachio. Everyone has their own specific flavor of low back pain. Certain things hurt, some things feel great. They may be completely different from one person to the next, right? So I tend to lump people into one of two different buckets, although there can be different flavors and a combination of both. So are you the type of person that hurts with flexion? All right. So these folks tend to hurt with sitting, especially for prolonged periods, right? One of the biggest examples is driving. So when you drive, you have to sit down in a flexed posture and you have to be in that position for a prolonged period, right? If that kills you, you may have what's called flexion-based low back pain. All right. The other thing that kills people with flexion-based low back pain is bending over to pick things off the floor because the spine has to flex in order to do that, and it kills, right? Currently, I have a bit of flexion-based low back pain, so it's bugging me to sit down right here and speak to you today. And I'll tell you what, it kills to put socks on. When I have to bend down and bring my leg up in order to put my sock on, that feels like garbage, right? On the flip side of things, some folks have what's called extension-based low back pain. So when you extend the lower back, it tends to hurt. These folks tend to hurt when reaching overhead or working overhead. They tend to hurt more with standing for prolonged periods of time. Certainly when you do an evaluation, when you have them extend from their spine, it doesn't feel good. These folks often hurt when you lay on the stomach and then especially press up from that lying on stomach position, okay? And also just keep in mind that most folks have a combination of both. And oftentimes, if you have a really irritated spine, kind of everything hurts. So it's really hard to lump someone into either flexion or extension-based low back pain. And over the course of time, as those symptoms die down a little bit, you're going to probably be able to bucket them more into one of these versus the other. Okay. So what are some strategies to limit irritation when you have either flexion or extension-based low back pain? So if flexion hurts, it's probably going to help to work at a standing desk instead of sitting all the time, right? The other piece is if you have to sit, sitting in a tall seat is going to help out. It's going to reduce some of that lower back rounding. Maybe you break up bouts of sitting with frequent walks and periods of standing. You can also try sitting with a roll behind the lower back to keep the spine a little more extended while sitting, or just sit in a more extended arch position when sitting in general. So right now, like I said, flexion kind of bugs my back. So I'm sitting in a position where I'm extended a little bit. I also elevated my seat some, and it feels pretty good on my back. I also know that after I finish recording this, I'm going to stand and walk around a little bit, right? Just to make sure my back doesn't kill for the rest of the day. Okay. Now, if you're one of those folks that has extension-based low back pain, what's going to help you? So maybe you want to actually sit more frequently throughout the course of the day. We know that standing is going to irritate these folks with extension-based low back pain. So maybe we're giving them the advice to sit a little more often, right? If you do sit down, sit with a rounded lower back. Now, it's common dogma, I'll say, that when you have low back pain, you shouldn't sit with a flexed spine, right? But in folks that have extension-based low back pain, if you sit in a lot of extension, it actually feels like garbage, right? So I'll educate these patients, hey, just let your back slouch. It's okay. It's okay for you. It's not going to be a problem to slouch with your low back. It's not bad. You're not going to cause more problems, especially if that feels better. It's probably going to help you, okay? You can break up your bouts of standing with frequent periods of sitting. Okay, kind of the opposite of our flexion-based low back pain patients. You can also stand with the pelvis in a posterior pelvic tilt. Okay, so tucking your tail like a scared dog. That's a cue that I commonly use for my patients to get posterior pelvic tilt. The other piece you can try is if you need to stand for extended periods, stand with one leg elevated on a stool to round the lower back a little bit. So how do we modify the gym lifts to continue training with lower back pain? And I'm talking about squats, deadlifts, and Olympic lifts. So those are the main culprits when folks have lower back pain. So goal number one is to find the hardest and most similar exercise variation the lower back tolerates well with minimal pain on a given training day, right? And what's my definition of tolerating something well? So for one, it should be less than or equal to about a 3 out of 10 on a 0 out of 10 VAS pain scale. So basically 10 out of 10 is the worst pain imaginable. 0 is no pain, right? We're looking for minimal pain during, but we want minimal soreness after we finish the workout. We're also looking for minimal soreness the following day. If I do a workout and it's tolerated well, but the next day I feel like garbage, I probably did too much on that prior day. And here's the thing, I would say that 50% or more folks have a delayed alarm system, in the sense that when they exercise, they may feel phenomenal, but they feel terrible the following day. So we need to make sure we educate our patients about this, because they're constantly confused why they can exercise but feel bad the following day. Well, to a physical therapist, that might be a no-brainer, but for the patient, it often isn't. So we have to connect those two and just make sure that people understand that, right? Lastly, we're looking for progress from week to week and month to month. Okay. And this could be with pain, but also could be with loading. Let's say that, week one, I can't tolerate squatting at all. Right. And then 2 weeks later, I can tolerate squatting. And then maybe 4 weeks later, I can actually squat with a little bit of load. I may have consistent pain over those 4 weeks, but I'm actually tolerating more and more. And that's progress. All right. And here's the thing, some patients will be able to get away with minimal modifications with their training. All right. And others are going to need more drastic training modifications. And a small subset may need to completely eliminate anything that resembles a deadlift. Okay. So if you have terrible low back pain, and it hurts so bad to even drive to the gym, then you may not even want to drive to the gym, because once you get there, you might not be able to do anything. All right. So if that's the patient that you're working with, maybe you give them a bit of a home training program, get their low back pain down a little bit, and eventually give them the advice to get to the gym, and then we can get some work done, right? So step one, we want to try to attempt to modify the load of a given exercise, right? So if day one, your patient's supposed to deadlift, I'd like to get them to deadlift if we're able to, right? We want to keep the exercise as similar as possible to what's written, right? So the person can continue working towards their training goals. We only change the movement if we really need to. So we're probably going to have to decrease the load of a given exercise. And there's a variety of different ways to do that. Oftentimes, a reason why people can't tolerate a given exercise is because it's too heavy. All right. So how do we decrease the load but still get a training effect? Well, for one, we can reduce the RPE, or the rate of perceived exertion, right? So 10 out of 10 means you're pushing as hard as you possibly can on an exercise. 7 out of 10, you had a few reps in the tank, right? So 7 out of 10 challenge is going to be a little less load. Oftentimes, you can continue progressing over the course of time and adding or continuing to work towards your training goals, right? By using a lower RPE. And I had a podcast about this. I'll leave that in the show notes as well. But you actually have similar improvements in strength, not training to failure versus training to failure. Okay. So if we have to temporarily reduce our RPEs training, we will actually continue working towards our training goals and probably increase strength and size at a similar rate, as opposed to going more towards failure. Right. The other thing we can do is slow down the movement. So instead of going full speed or being explosive with our reps, we can slow them down. Maybe that's 2 seconds on the lower, 2 seconds on the way back up. And oftentimes we slow things down and reduce the load. The low back tolerates that really well. The other thing you can try is adding pauses to your reps. I do this pretty frequently. So let's say you're supposed to squat for the day, and as opposed to doing your normal sets of 5 reps, with heavy load, you can slow things down a little bit and add a pause at the bottom and the top of each movement. And what this is going to force you to do is decrease some load on the bar, but you're still going to get a good training effect, right? And the other piece that's really effective that I do all the time is just increasing the repetitions. So your 5 rep max is going to be close, it's going to be heavier, right, than your 12 rep max. So if you're supposed to be doing 5 reps on a given training day, it's pretty easy to just do 10 or 12 reps on that given training day. Oftentimes that's enough to have minimal pain while we train, right, and get through that day and spare the back, right? So what if we can't actually continue using a given exercise for the day? So I kind of fall in this boat right now. If you ask me to go deadlift, if I slow down the movement, if I increase the reps, if I tried all those strategies I just talked about, there's no way I'd be able to tolerate it. I can't even bend forward right now. Okay. So I have to modify. So step two is attempt to find a similar movement, right? So we don't want, this is a big mistake. So folks that have low back pain, right? They go to the gym, they'll say, deadlifts hurt. So I didn't do any lower body strength training. Okay. That's not good. We want to stress the area a little bit. We want to continue working towards our training goals, right? And the other piece is that another mistake people make is that they'll say deadlifting hurt, so we substituted, let's say, a squat instead, right? And although that's not a terrible substitution, it's better than just doing upper body exercises. We want to keep training as similar as possible without aggravating the area, okay? And the other piece is that stressing the area will appropriately cause adaptation of those tissues. So we want to try to find a deadlift modification that's similar, right, to the conventional deadlift that we're supposed to do that day. Before we get into the modifications, I want to give you some low back exercise prescription basics. Okay. So we need to know how we can increase or decrease stress on the spine in order to find the best exercises for the day for our patients. All right. And here's the thing, I have a very in depth lecture series about exercise prescription for lower back pain. It's inside of Fitness Pain Free Insiders, right? I'll leave a link in the show notes. It's $1 for a week trial. Okay. Super cheap. And you get a very in-depth lecture on this. So definitely check that out if you want more. But let's go over some of the basics. Okay. So the first one is going to be torso inclination. The more I incline my torso forward, the more shear force we put on the spine. And the more I send my hips back in order to do that, creates more of a moment arm at the hips. And that puts more stress on the spine as well. Okay. So if I lean my torso forward, more shear stress on the spine, larger hip moment arm, more stress on the spine as a result. Okay. The other piece that is going to increase stress on the spine is going to be how much degree of spinal motion you have. So if I go into a deeper squat or a deeper deadlift, so think about, let's say, a rock bottom squat, or think about a deficit deadlift versus a rack pull, I'm going to flex the spine a little bit more. Okay. When the spine flexes, it's just a little bit more work for the spine. And in folks that don't tolerate, let's say, flexion, oftentimes that can be a little more painful, a little more stressful. Okay. The other piece that's an absolute no-brainer is load. So heavier load is just going to be more stress on the spine. Okay. And the last one is speed of movement. So I've moved more quickly, it's more stress on the spine as opposed to moving more slowly. So think about a power clean from the floor versus a tempo deadlift. That tempo deadlift with the same load is going to be a little less stress on the spine than doing an Olympic lift with full speed. So how do we modify the squat when you have lower back pain? All right. So let's say on a given training day, you're supposed to be doing low bar back squat. Okay. And that feels terrible. We can't modify the speed of movement. We can't modify the load. It just hurts too much. What do we do? So here I have a modification ladder. So the low bar back squat is actually the toughest movement I can think of for the lower back when it comes to squatting. All right. If we want to decrease the stress on the spine, we can get a little bit more upright. Okay. We can send the knees forward some, and we can try a high bar back squat. Okay. Now, if the high bar back squat is still too painful, we can get even a little bit more upright. We can drive the knees forward a little bit more by using a front squat, which is going to get more upright in the squat or in the spine. It's also going to increase the moment arm at the knee. So it makes the knees contribute a little bit more. It takes some of the stress off the spine. Okay. If we can't tolerate a front squat, we may try a goblet squat. And the goblet squat is great because we simply can't use as much weight as a front squat. It's hard to hold a 200-pound dumbbell, right? You have to decrease the load because a goblet is just hard to carry, right? And lastly, if squatting is not feeling great, we'll switch over to a single-legged strength training exercise like a split squat. Okay. So basically, we're looking to try and find the hardest variation your spine handles on that given day by utilizing the modification ladder here. Now, I have all of these modifications in the show notes. I have an entire article on how to get out of lower back pain and back to training. So if you want to download these training modifications, definitely check that out. So let's say the lower back is killing you and you're supposed to deadlift on a given training day. How do you modify things? All right. So in this modification ladder to the far left, we have the hardest exercises on the spine from a deadlifting perspective. And the hardest exercise is going to be a barbell deadlift. Okay. If barbell deadlifts are not tolerated well, first exercise I'll try next is going to be a low handle trap bar deadlift. A trap bar is going to allow the knees to travel forward a little bit. It's going to decrease the moment arm for the hips slightly. It allows the quads to produce a little bit more force. So now the legs are involved a bit more. The hips and low back are not taking as much stress. If the low handle trap bar deadlift is not tolerated, I'll try a high handle trap bar deadlift. This is going to bring the hips a little higher. It's going to decrease the torso inclination a bit. And sometimes that's enough so that you can deadlift on a given training day without much pain. If that doesn't feel great, I'll attempt an elevated kettlebell deadlift. Generally speaking, you can't utilize as heavy of a load when using a kettlebell as opposed to a trap bar. So despite the lift mechanics being very similar, usually the kettlebell deadlift is tolerated better just because the load is less. If the kettlebell deadlift is not being tolerated, I'll switch over to a hip thrust. Hip thrusts are super interesting because they're generally very well tolerated in folks that have low back pain. So if the deadlift is just not happening on a given day, we'll try the hip thrust. And what's interesting about the hip thrust is it has a very similar EMG. All the muscles in the deadlift that are very active are also very active in the hip thrust. So we're actually training a very similar set of muscles in the hip thrust as compared to the deadlift without irritating the spine. And lastly, we can try some single-legged strength training. So I prefer to use a single-legged deadlift because it's more similar to a regular deadlift. And if you can't tolerate that, then sometimes we'll switch over to, let's say, a lunge, which is a little more quad dominant, a little less stress on the spine, but still allows us to train the lower body on that given training day. How about the Olympic lifts? If your lower back is killing you and you're supposed to clean on a given day, what are you supposed to do? Okay. So the hardest exercise on the lower back from a clean perspective is going to be a full squat clean. Okay. And this is because you're lifting from the floor and you have to get into a deep squat. Both of those are pretty challenging for the lower back. So the first modification I'll try in folks who have low back pain when they clean is switching over to a power clean. Okay. So we simply eliminated the squat portion. Some folks just don't feel great in the bottom of a squat. So removing the squat portion and just doing a power clean is sometimes well tolerated. Let's say that doesn't work out well and that pulling from the floor is still pretty painful. You can try a hang clean, right? So don't allow the barbell to go past the knee, right? And you can avoid the squat too if you need to. So a hang power clean variation eliminates the pull from the floor and also eliminates the squat. And oftentimes this is tolerated well, okay? Now, if someone doesn't tolerate a hang power clean, what can you try? The last modification I would try is just a high hang power clean. The reason why the high hang is pretty nice is you just can't use as much weight, right? Because we can't create as much momentum in a high hang position. The other piece in a high hang position, torso is very upright and we're just dipping at the knees, kind of like a jerk, right? Given the torso is so upright and the weight is so low, oftentimes this is something that's tolerated really well. Okay. So hardest exercise, full clean. Easiest exercise, high hang power clean. Choose whatever you need to so you can actually train on that given day. Same thing goes for the snatch. So in the snatch, a full snatch is going to be the most challenging for your lower back, followed by a power snatch, followed by a hang power snatch, and lastly, high hang power snatch. So I'm always talking to my patients about how we can continue training with lower back pain, and I'll just utilize the variation that people can tolerate. And over the course of time, we just make the movements more challenging to get back to snatching. So the next one to talk about is the jerk. All right. So if your low back is not tolerating jerks on a given training day, how do we try to continue training in a way that's similar to the jerk without irritating the back? Right. I do feel that the split jerk is usually the most challenging for folks with extension-based low back pain. And this is often because of the trail leg, so the leg that's behind you when you finish a split jerk. The leg that's behind you, if your knee is not bent, it's going to extend the spine more. If you have extension-based low back pain, this can really hurt. So the first thing I'll do is I'll just tell my patients to make sure that back knee is bent and try to maintain neutral position when you catch the barbell. Okay. If that fixes the problem, then great. We don't have to modify things. However, if you're still having pain, we can try a push jerk. Just because you don't have the trail leg behind you, there's less extension on the spine. And if that is just not working, the back is still killing, then we'll try some other sort of overhead press modification. So we can try a barbell press. If that doesn't feel great, we can try a dumbbell press. There's a little less lumbar extension in a dumbbell press just because the barbell doesn't have to go in front of the face, right? Folks are a little more apt to lean back in a barbell press because if they don't, the barbell is going to take out their chin, right? In a dumbbell press, we don't have that problem. If that's feeling bad, we can try a half kneeling dumbbell press. Half kneel is usually helpful because we have one leg up, which is going to posteriorly tilt the pelvis and put the spine in more neutral position. Lastly, if that's still killing, we can try a seated dumbbell press. When you sit down, you have more flexion at the hips, more posterior tilt, more lumbar spine flexion. So usually it feels a little bit better. And generally speaking, we're just trying to utilize a variation that's most similar to the split jerk that you can accomplish on a given training day. And then over the course of time, we make the movements more challenging as the back starts to feel better. So, one honorable mention that I wanted to talk about in folks with lower back pain is going to be blood flow restriction training. In blood flow restriction training, we're only using 20% of our 1 rep max, and we're usually doing a set rep scheme that's similar to 30 reps on your first set, followed by 30 seconds rest, and then 15 reps, 30 seconds rest, 15 reps, 30 seconds rest, and then 15 reps. So 30, 15, 15, 15 with 30 seconds rest in between, right? So if you've never tried blood flow restriction training, you're taking blood pressure cuffs. They go around your thighs. You pump the cuffs up in the lower extremity to around 80% occlusion, right? And what happens is that normally when you exercise, you have blood going to the area, and that blood causes cellular swelling, and you also get acidic byproducts that build up, right? And we believe those two things will actually increase muscle strength and hypertrophy over the course of time. When we use blood flow cuffs, we get a lot more cellular swelling and we get more acidic byproducts building up faster just because we're not allowing blood to leave the area as fast as it normally would. Okay. And what happens is the muscle fatigues way faster than it normally would. And that's what's driving some of these adaptations, right? What's cool is you only need 20% of your max to do that. So if you have a super load intolerant spine, you can get away with some good, let's say, squat and or deadlift training, right? That's going to drive some adaptations without aggravating the spine, right? And this is actually something I use all the time in my athletes that have lower back pain, they can't squat with load. It's really a nice adjunct to training to try if nothing else is working, right? And as I mentioned earlier, if you want to download all of these infographics so you can see how to modify your patient's training when they have low back pain, I have a link in the show notes under the ultimate guide to getting out of low back pain and back in the gym. Definitely check it out. Use it as a reference. They're super handy. Step 2, we're looking to identify and correct mobility limitations in the ankle, hip, shoulders, and thoracic spine to reduce stress on the lower back. So here are the general principles. Limited mobility in one area can force more work for the lower back. Okay. So if I have poor ankle dorsiflexion, or if I have poor hip flexion, then what happens is I'll descend in my squat. My hips are forced to go back further because I don't have ankle dorsiflexion. And my lower back may have to round a little bit more because I don't have the flexibility in my hips or the ankles, right? Really, we're just forcing a little bit more work for the lower back. Now, if you have a patient that has lower back pain and we back off a little bit of things to aggravate it and slowly work back to training and they're doing fine, you might not have to mobilize anything because you've shown that they can adapt to those positions well enough. And we don't have to try to mobilize things and change someone's technique. But if you have an individual that has, let's say, flexion-based low back pain, they have major stiffness in their hips and ankles, and we eliminate offending activities in the gym, offending lifestyle activities. They get out of pain. We slowly ramp them back into squatting. And what happens is that no matter what we try, we can't get their low back to adapt to the old technique that they used to use. They always keep getting flare up over the course of time. I would consider in these folks trying to change their exercise technique. You can add a heel lift, add an Olympic weightlifting shoe, mobilize the ankle, mobilize the hip, change that technique. All right. So this is kind of a nuanced discussion, but just keep in mind, we can dose stress to the spine a little bit differently just by changing mobility, right? And the areas of focus are really going to depend on your goals and the individual, right? So the thoracic spine can limit overhead motion, and it can cause a little more stress on the lower back, especially if you're an Olympic weightlifter, right? The hip can certainly do the same. So if I'm limited with hip flexion range of motion, my lower back will have to round a little bit more in the bottom of squat. Same thing goes with the ankle. If I'm restricted in my ankle, it's going to force more torso inclination in the squat. It also may drive a little more hip flexion. So getting more ankle dorsiflexion will allow me to stay a little more upright, makes it a little bit more of a low back friendly movement when I'm squatting. In the front rack, if I'm limited with mobility there, it can lend to some problems in the lower back and also at the shoulder. So if I have limited motion at the shoulder, when I go overhead, I may extend the spine a little bit more in the snatch and the jerk, right? Now, here's the thing. This is not a mobility lecture. However, if you want to see all of my assessments for mobility, right, in all of these areas, then all you need to do is check out the ultimate guide to getting out of lower back pain. I have the assessment and this article in the show notes, so check that out. Okay. Step 3, we want to correct technique issues in the squat, deadlift, and Olympic lift. Here are the general principles. Now, I know I am bringing out a can of worms when I say this, but generally speaking, we're looking for a braced neutral position of the spine when we squat and we deadlift. And the idea here is that having a braced neutral position during these lift is going to allow even dissipation of forces throughout the spine when lifting. Okay. So if I go into a squat and my spine starts to flex, that could increase some of the stress on the intervertebral discs. Okay. I know this research is mixed, right? I'm not trying to argue this point right now, but I'm generally looking to find a brace neutral position for most of the folks I'm working with. Okay. A brace neutral position is going to improve the low back muscles efficiency to reduce shearing forces in the spine. Okay. When I do a deadlift or a squat, my torso is going to incline forward, and that's quite a bit of shear force. If I'm neutral, it's going to help out those muscles. Okay. Lumbar rounding or flexion of the spine can put more stress on the anterior structures on the spine, like we talked about. So, the anterior structures on the spine are kind of the spinal discs. And if the spinal discs are taking too much stress over the course of time, if what you're doing is exceeding the disc's ability to handle the loads, right? If the recovery that you have in between sessions is not enough, if the annular wall is not strong enough, you may cause a disc issue that may cause problems over the course of time. Same thing goes with lumbar extension. So if you extend too much during a squat, deadlift, any Olympic lifts, if you arch the spine too much when you press overhead or when you're bench pressing, this is going to cause more compressive stress on the elements on the posterior or backside of the spine. And maybe that's going to lead to more spondy issues over the course of time as opposed to staying a little bit more neutral. Okay. So that's constantly what's going on in my mind when someone has a low back issue. We're trying to figure out how can we be a little bit nicer on the spine in the future from a technique perspective. Okay. So we want to be able to coach a brace neutral position in squats, deadlifts, and our overhead lifts. Now I have some really good videos on how to do this, and I'll put the link in the show notes for the squats as well as deadlifts. Okay. When it comes to overhead lifts, the same rules apply. We want to stay braced and neutral. So you have someone that is hyperextended when they press overhead. We want to make sure we're coaching them and cueing them appropriately so they stay a little bit more neutral. Okay. Like I said earlier, if they're extending too much during split jerks, we have to make sure that backside leg, that trail leg knee is bent, the glute is flexed, and we're holding our torso in a neutral position. Okay. If someone has a lot of overhead mobility limitations, they're naturally going to arch a little bit more. So we may have to mobilize the thoracic spine, mobilize the shoulder, decrease the load a little bit so they can press overhead in a more neutral position over the course of time. Step number 4, we want to start gradually loading the spine through a progressive strengthening program. Okay. And here's the thing, in the large majority of the rehab programs that I write, and this is not just for low back pain, it's for most things, but certainly with low back pain, our goal is to reduce the intensity of exercise, but we're increasing the frequency of exercise. Okay. So that may mean I am reducing the weight on the bar, but I'm actually stressing the spine more frequently than I normally do. Okay. We're going to put more focus on the injured area and the helper muscles. So in terms of stressing the injury site, I want to do this 3 times per week, right? So I'm going to do exercises for the lumbar spine 3 times a week. And the goal is to drive tissue adaptation, right? I want to have the structures in the spine to adapt to the training stresses. Okay. We're also going to be working the helper muscles, and we're doing this 3 times a week. Which movements or which muscles are these? The glutes, the core, hamstrings, and even the quads and the calves. Okay. All of these things are going to help to contribute to force production during squats, deadlifts, and Olympic lifts. And I want them all to be up to snuff so I can optimize my movement. Okay. And lastly, we're looking towards building a balanced strength training program. Okay. So generally speaking, if you're following or if your patient is following a strength training program that's smart and it was designed for them, I actually want them to continue with that program as much as possible while we're rehabbing. Okay. So continue with the upper body stuff. Don't stop doing everything else, because I think that's actually important, A, for working towards your fitness goals, but B, I think it's going to allow you to help rehab a bit faster as well and keep your sanity. What are the best physical therapy exercises for lower back pain? Number one, lumbar spine slash glute work. This is good mornings, hip thrusts, and back extensions. Number two, carries and marches. This could be a suitcase carry, farmer's carry, or kettlebell front rack carries. Number three, single legged strength. This would be single legged deadlifts, lunges, and step up variations. Number four, anterior core work. This could be crawls, ab wheel work, or plank variations. Number five, lateral core work, like side bridges and pillar holds. Number six, rotational core work, like renegade rows and anti-rotation presses. So here's the thing. If you just want to see demos of all of these exercises, there's a link in the show notes to check out an article that has all of my favorite physical therapy exercises for low back pain. Okay. If you want to hear about why I like these exercises, then keep listening. All righty. So one, lumbar spine work and glute work. This is going to be good mornings, hip thrusts, and back extensions. Okay. So why do I love these exercises? Well, it's basically like medicine for the lower back. When we do these movements, it directly stresses the spine. If you've ever done good mornings before, you'll know, like, hey, this is pretty intense on the lower back. I have people tell me all the time, like, I am having a hard time feeling my hamstrings in the good morning. I just feel it all in my back. And I'll respond with, hey, don't worry about that. We actually want the lower back to be working a lot. You don't have to feel everything in the hamstrings. Are the hamstrings working? Yes. But tell you what, the low back is doing a ton of work there, right? And obviously, if someone's super irritable, they're probably not going to be able to handle a good morning. But over the course of time, once they're able to handle it, I want to throw the good morning at them, just because it's going to directly stress the spine. And that stress to the spine is very similar to what we're trying to get back to, which is squats and deadlifts, right? So on the spectrum of hardest exercise to easiest exercises, like I said, the good morning is probably the hardest, followed by the back extension, and finally hip thrusts. So most folks in low back pain can tolerate at least one of these exercises on the spectrum. If you're highly irritated, maybe you're doing hip thrusts and glute bridges. And as we start to get better over the course of time, we work our way up to back extensions and finally good mornings. Number two, carries and marches. So I love farmer's carries, suitcase carries, kettlebell front rack carries. If you have access to it, a yoke carry is great as well, right? All sorts of carries are phenomenal for low back pain. Now, why is this? Well, first and foremost, the carries are really great for working your lateral core. So what I'm talking about are the obliques, the quadratus lumborum, your spinal extensors unilaterally. So basically, when you hold a weight, let's talk about a suitcase carry. The weight's trying to pull you down to the floor, and your spinal extensors on one side have to fire to keep that from happening. And lastly, the glute medius, which same thing, your glute medius on one side has to fire hard when you're on one leg. Okay. And all of these muscles are important in low back pain. And the reason why I like carries so much is they're generally well tolerated. So if you have a spine that's pretty irritated, oftentimes you can pick up some weights. Your torso is very upright. It's not that challenging on the spine, and get away with some walking, marching, all the like. So I love applying these exercises to my patients with low back pain. Number three, single leg strength work. Now, this would be single legged deadlifts, lunges, and step ups. So, why do I love these exercises? So, first and foremost, it allows you to continue doing lower body strength training. Okay. And that's really important. When we have an injury, we don't want to stop training, right? And lower body strength training, if we do single legged stuff, is oftentimes not that irritating to the spine and allows us to accomplish that goal, right? It's better tolerated than bilateral movements like squats and deadlifts. So if you think about a squat, oftentimes the limiting factor in a squat or deadlift is going to be the lower back, right? Not the legs. But if we do a single-legged exercise like a step up, now the leg is more the limiting factor and not the spine. Okay. And because of this, like I said, we are able to train the lower body without aggravating the spine as much. Okay. In terms of dosing, so the hardest exercise on one leg for the spine is usually some sort of single-legged deadlift. This is because the torso is going to incline forward. We're creating a nice strong moment arm for the hip, and that's going to increase stress on the spine. Now, if you can handle these things, great. If it's well tolerated, keep them in the program. But if you're having trouble tolerating single-legged deadlifts, you can try, let's say, a lunge with a longer stride, which is going to be a little bit more upright torso, right? Which generally feels a little bit better. And if that's still not feeling great, you can try, let's say, a goblet step up with a low box. And in this case, you're getting a lot of lower body strength work, but your torso is nice and upright and you don't have as much stress on the spine. Okay. So generally speaking, single-legged strength training is a very sneaky way to train the spine a bit, right? When you have low back pain, just because if you're holding a weight in front of you, let's say in a goblet, you still are firing the musculature in the core and the low back just to stay upright. So you're actually getting a decent amount of low back strength training, despite it being a bunch of leg exercises in nature. Number 4, anterior core work, right? This would be crawls, ab wheel, or plank variations, okay? Now, why do we like these exercises so much with lower back pain? This is your classic core stability work, right? And there is a ton of research on core stability work being helpful to reduce lower back pain. And here's the thing. You don't necessarily need to do core work in order to get out of low back pain. A lot of active approaches will help, but suffice to say, core work and stability work is very evidence-based way of reducing lower back pain and getting back to the gym, okay? The other reason why I like anterior core work is for extension-based low back pain folks, right? So in folks that have extension-based low back pain, their spine doesn't like to extend, right? And if we're working a bunch of anterior core muscles, we're working the muscles that help us to resist extension, okay? And that helps to build trust with our body. The spine can handle movements to extend the spine over load, okay? So when I'm trying to press something overhead, anterior core is very important to keep me from extending too much and irritating the spine. If I have a really strong anterior core, then my brain is probably less apt to give me pain because it feels like it has the strength and control over that motion, okay? Number 5, rotational core work. So this would be a renegade row or anti-rotation press. So why do I like rotary work so much? Well, it's great to work the obliques, the glute max, the lats, and the paraspinals. All these muscles can be involved when you have lower back pain, and it's a good way to start training those to get out of pain, right? The other reason why I like this so much, and it's not as specific to folks in the gym, right? It's more specific to folks that do rotary sports, okay? So the champion physical therapy and performance, we see a lot of baseball players. Baseball players end up with spiny injuries from a lot of hitting, right? So a lot of batting practice. And what probably causes these issues is a combination of extension and rotation, okay? So we want to try to work all the rotary muscles in the core to help build trust the spine can handle movements that extend and rotate the spine under load, all right? It's going to build the strength control where we need it to reduce some of the stress on the low back in that area that's injured. Step number 4, we want to start gradually loading the spine through a progressive strengthening program. Now, we want progressive overload of the spine. And all that means is that your program, your rehab program, should start easy and get harder over the course of time, okay? And what that means from an exercise selection standpoint is you're starting with lighter loads and you're progressing to heavier loads. You're starting with a shorter range of motion. You work towards a full range of motion. We start with exercise variations that are a little bit more quad dominant, and we work towards exercise variations that are a little more hip dominant, because the hip dominant motions are going to be a little more challenging for lower back. And lastly, in terms of speed of exercise, we start with slow movements and you work towards explosive movements, right? So let's say a tempo deadlift versus a power clean. So here's a physical therapy program for lower back pain during squats, okay? So if I have lower back pain and squat day pops up, what should my program look like initially? And as I progress over the course of time, how do I make the program more and more challenging to return back to my normal squat routine? Okay. So maybe during week 0 to 2, you're pretty flared up. What would your low back pain, what would your rehab program look like on a squat day? So let's say you're supposed to do a barbell back squat, but that feels like garbage. So instead of a barbell back squat, your first exercise of the day is a goblet squat to a bench. I like to combine that with some sort of anterior core exercise because that's helpful to get out of low back pain, right? And on your next exercise, you're supposed to be doing a heavy barbell reverse lunge, but that doesn't feel good because the heavy load hurts your back. So you may try a goblet split squat with a bit of a tempo, okay? This allows us to train our legs in a way it doesn't irritate the spine. We slow down the movement a little bit so the spine tolerates it even better. And I'll often combine that with another core exercise because, like I described earlier, doing core strengthening is something that helps us get out of pain, right? So we're able to train the lower body a little bit on this given training day. Plus, we incorporate a few rehab exercises to push us into a better place even faster. Okay. Now, let's say you do this for 2 weeks, you're starting to make a little progress. How does your program change? So let's say instead of a goblet squat to a bench, we're now doing a goblet squat through a full range of motion, which is a little bit more challenging. All right. We still have the reps pretty high, so we're not doing anything heavy yet. So 3 sets of 8 with a controlled descent and a 1 second pause in the bottom. Adding a tempo is a really nice way to continue training with reduced load because typically when your back is killing you, you can't use heavy weights, right? I like to couple that again with another core exercise. So we're doing dead bugs again. And then after we finish up our goblet squats and dead bugs, we need to do some single-legged strength training. We're getting a little bit stronger and the back is feeling better. So now I'm doing a goblet reverse lunge. I'm doing 3 sets of 8 and I've taken away the tempo some, right? So I'm going full speed because the back is feeling better and I'm able to start increasing the loads a little bit. Okay. Again, I couple that with a side bridge or side plank. And this time I'm taking my feet apart, right? Which is a more challenging variation of the side plank. So things are getting harder from a core perspective as well. All right. Let's say I tolerate those next 2 weeks really well and I'm ready for something that's even more challenging. What am I going to do on weeks 4 to 6? Well, we're just going to make things a little harder again. So exercise 1, which is our squat variation, we're now turning this into a front squat. So with a front squat, the motion is actually very similar to a goblet squat, except in a front squat, you can add more load, right? And as you'll see here, we're starting to decrease the reps a little bit. So instead of sets of 8, now we're doing sets of 6 to 8, which means that we can put a little more weight on the bar, right? Because now the spine is tolerating more load. Okay. Again, we couple that with another core accessory exercise to help with the low back pain. Our next exercise is a lunge variation. Our back's feeling quite a bit better. So now we can do a barbell back rack reverse lunge. There's no tempo, all right? And the loads are going to be heavier than a goblet hold because when you hold a weight on your back, it's a little bit easier to load up than when you carry it in the front with a goblet. And we couple that again with a side bridge and the back is feeling even better. So we incorporate another exercise. This time we have a dumbbell Romanian deadlift. So we're increasing the stress on the challenge increasing the stress on the lower back over the course of time. Okay. Let's say you're doing great and you're ready to advance week 6 through 8. Now we're doing a barbell back squat. Okay. So we progress all the way from a tempo goblet squat to a box, all the way back up to a back squat. And what you'll notice here is we're doing sets of 5. So usually a back squat is a little bit heavier than a front squat. So we're advancing from that perspective. And the other piece is that we're decreasing the reps again. So we're increasing the load. After that, we're going to do a barbell Romanian deadlift, which again, very stressful for the spine, but our back can handle at this point, and we want to continue advancing. Okay. Couple that with a lateral pillar hold. If you've never tried these before, they're extremely challenging. They're definitely harder than side bridge variations. So we're progressing from a core perspective. And then we also have a barbell front rack reverse lunge coupled with a lateral bear crawl. So generally speaking, we're just increasing the challenge of the exercises over the course of time. We're incorporating harder and harder core stability exercises as the back tolerates it. And eventually we start progressing back to whatever program you're doing previously, right? So here's the thing. If you want a full done for you program from A to Z, right? What to do on week 1 versus what to do on week 10, I have that for you. It's called the Ultimate Training Program to get out of lower back pain and back to train lifts that you love. I'll leave a link in the bio. So if you want everything, all the guesswork taken away, I've got that for you. All right. Link in the show notes. So I have a lot of references for this lecture today, and I will leave that all in the show notes for you. I think we have 37 different references, so definitely check those out, especially if you had any particular questions on one of the citations that I had. All right. Thank you. Thank you so much for listening today. I really appreciate all of your support. If you're watching this on YouTube, please give me a thumbs up. Comment. I'd love to hear your thoughts on how you do your rehabilitation for low back pain and subscribe to the channel. If you're listening to this on the podcast version, please give me a positive rating and review. Helps the algorithm out, helps me to grow over the course of time, allows me to continue working and bringing out more content, right? And if you want to go that next step to really support me further, consider subscribing to Fitness Pain Free Insiders. So head to fitnesspainfree.com, click on the programs link, and then click on Fitness Pain Free Insiders online library. Just $1 to get started with more great learning. I will leave a link in the show notes. Thank you very much.